Telemedicine Mexico Vertical Bar Medical Care. Medical care includes a variety of different services that improve one's health. These services can range from preventing illnesses to treating them. They are provided by trained health professionals and allied health fields. Healthcare is an important aspect of life, and it is vital that every individual have access to it, especially those who are in need of help. Medical health. Healthcare is a complex system that promotes human well-being through prevention, diagnosis, treatment, and cure of health problems. These services are delivered by health professionals and include allied health fields, primary care, secondary care, and tertiary care. They also include public health. Healthcare services vary widely across countries, communities, and individuals. Access to and quality of healthcare can affect the quality of life and effectiveness of treatments. Medical exam. A medical exam is a physical examination of a patient by a medical professional. The exam is done to find out if the patient has any symptoms or signs of illness. It is also referred to as a clinical examination. A medical practitioner will also look for any abnormalities or changes that the patient may have. A medical examination involves the review of a person's medical history, a physical examination, and tests to detect communicable diseases. In some cases, a doctor will perform a COVID-19 vaccination, although this is not required. It is also important to note that a patient is allowed to have a chaperone present during the exam. If you are applying for a green card, you must undergo a medical examination. The examination will reveal whether or not you have any disease that would prevent your application. The U.S. Citizenship and Immigration Services, USCIS, oversees the medical examination. Common health conditions that prevent entry include communicable diseases, failure to present vaccination documentation, and physical or mental disorders causing harmful behavior. The physical exam covers your entire body. It usually takes 30 minutes and includes a series of tests to determine your health status. A doctor will also assess vital signs such as blood pressure, body temperature, and pulse rate. The physician may also perform other tests or recommend follow-up care for your condition. Home health care. Medicare and some private insurance plans cover home health care when it is ordered by a physician. This type of care is available to seniors who meet the requirements. However, some people may need to pay for this type of care out of pocket if they don't have Medicare. Alternatively, long-term care insurance may also cover this type of care. Home health care clinicians are responsible for providing care in a unique environment, which creates unique risks. Unlike hospital safety departments, home health care clinicians may not have access to the necessary resources to control these situations. For example, hospitalized patients receive antibiotics at therapeutic intervals, whereas patients in home health care are likely to receive the medications on an irregular schedule. Home health care services include physical therapy, occupational therapy, speech therapy, medical social services, and home-based assistance with daily activities. Typically, home health care is less expensive and more convenient than hospital care, and is often just as effective. Medicare and some other health insurance plans may cover the cost of home health care services, so it is essential to know your benefits before signing up for the service. Home health care services are specialized services delivered in the patient's home by licensed medical professionals. These services can include skilled nursing, physical therapy, occupational therapy, speech therapy, and social services. These home health care professionals help patients recover from illness and regain their independence in the comfort of their own home. They also act as a liaison between the patient and their physician. The home health care professionals record every visit and send regular updates on the patient's condition to the physician. This helps the physician remain aware of the patient's condition and ensure continuity of care. Telemedicine. Telemedicine has many benefits, from improving the experience of patients to monitoring complicated diseases. It has also improved access to medical care and reduced the cost of trips to hospitals. However, there are many technological and financial limitations to this innovative way of providing care. Nonetheless, telemedicine has the potential to improve access to medical care and address healthcare disparities. One of the major benefits of telemedicine for medical care is the development of a doctor-patient bond. The doctor-patient relationship can be strengthened through video calls, which are a great help in diagnosing patient conditions. Telehealth practitioners can also provide sound advice and guide patients in active use of the technology. Another benefit of telemedicine is that patients can be empowered to manage their own health. They can communicate with their case manager and request support services as needed. Each center has a telemedicine coordinator who can assist patients with using the technology and can help patients understand the benefits of telemedicine. This is a great benefit for patients who are ill and have limited mobility. Telemedicine is also useful for patients with poor acuity. It can also be used to address a rapidly evolving epidemic or a devastating situation. However, some researchers feel that the utility of telemedicine will diminish after the COVID-19 pandemic is over. What should I look for a doctor? Ideally, the best doctors will make their patients feel as comfortable as possible during the consultation and follow-up visits. They should also have a friendly demeanor and be open to communication outside of the office. Good doctors will also have clean offices and respect your time. They should have the time to listen to your concerns and explain your condition in detail. It is important to note that gender can play a role in communication with a doctor. Some patients find a male doctor more comfortable talking about their problems than a female doctor. However, this does not necessarily have to be the case. Moreover, a good doctor should be cooperative, calm, and analytical. Moreover, they should also be friendly and gracious, and they should also be knowledgeable about their field. The most important thing to look for in a doctor is his or her ability to communicate with patients. Good communication skills are key in any doctor's role. Good communication skills make it easier for patients to understand the physician's advice and treatment plans. A doctor should also make patients feel comfortable discussing their concerns and feelings. If a physician makes patients feel comfortable sharing their feelings, they are more likely to follow their recommendations. Another important factor to check is the doctor's language proficiency. Many physicians communicate with patients through email or an online portal, but it is always helpful to find a doctor who speaks your language.